Today I have Mr. Festo Mwebaze, and let me just invite him to introduce himself. So yes.
All right. Thank you, Mr. Faisal Piper. Like you said, today's topic is really interesting and close to my heart. And we shall be looking at the emerging trends in health marketing. We shall dissect it really well to understand what health marketing is and what are some of the things that are coming up in the health marketing industry, and really what organizations that are in the health care industry should start thinking about as we go in the future, really, because we are looking at the things that are emerging, things that we should really keep an eye on, things that have worked in other markets or have started working in the Uganda market. So really it is very interesting, and I'm glad to be here. And I can tell the listeners that please relax and let's dissect this together. We would like to have good engagement, so please, you can like, you can share, but you can also post your questions so that we can be able to probably speak to them. Over to you, Parifa.
All right. Thank you so much. So, it was a shocker when you told me you're going to speak about healthcare marketing, because most of the tutors I invite, it's just marketing, insights, CRM, social media, digital marketing. But when I asked you and you said healthcare marketing, I was like, wow, okay, maybe you have a hospital or something. But let's just dive into it with the definition of healthcare marketing, because I am sure the people watching and some of the people listening might not know what healthcare marketing is, just like I did not know. So, in brief, just tell us about healthcare marketing, please. Thank you.
Yes, so really thank you, and I like the fact that you are appreciating the uniqueness of health marketing in the realm of marketing. So, and I think this is breaking the ice, but also removing the myth of saying marketing is different and then other industries are different. Because when you look at what marketing really is about looking for needs, anticipating needs of people and bring solutions. So it cuts across all the industries. So in health, there is marketing in health. There is marketing in telecom. There is marketing in fast-moving consumer products. And now, answering to your question, what is this health marketing? So the evolution of health marketing has really taken a long journey, and really it is the art or the science of using traditional marketing strategies. Talking about the 4 Ps, like price, place, people, the 4 Ps, to actually promote the health of people. So it cuts across many aspects of promoting health. So you can talk about how do we influence people to, for example, washing their hands before eating. That takes communication skills and it takes marketing. It can go to other avenues like in the pharmaceutical industry, where you are a scientist or you have manufactured a drug, but you have to get people to know it. So it takes communication, it takes you understanding what strategies am I going to use to get the key decision makers in the hospitals, in the Ministry of Health to take on my drug, and the doctors to prescribe the drug. It goes all through to insurance. Now we are selling a lot of insurance, But it is not only in that aspect, but also look at what government is doing in terms of health marketing. Actually, there is a whole department called health promotion at Ministry of Health. And what they do is to say, how do we sell the ideas of improving the health of Ugandans to the Ugandans? You've heard of things like the vaccine recently. We got blessed, we have donated some vaccines, but some vaccines were taken to areas and they nearly expired. So that all encompasses health marketing, that in as much as you bring the service, you need to educate people and communicate to them and tell them why it is important for them. So that is health marketing for you. So we're not lost.
Okay, all right. So that means, if I'm getting you correctly, there's healthcare marketing. It's in insurance, it's in pharmacy, it's in advocacy, it's in government institutions, and it's also in hospitals.
Yeah.
But okay. That's amazing. Because most people, when you hear something like healthcare marketing, you tend to think it's just hospitals doing this. Yeah. But now that you talk about it, on my way here, I actually saw two billboards. I saw a billboard of AAR insurance, and I said, wow. All along, I thought it's just hospitals telling us, "Oh, guys, come and get immunized, immunization for free, blood donation is this and that, da 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 da," and I was blown out. So by the time I reached here, I had actually thought about it and said, healthcare marketing is almost in every field of health. Yeah, even the laboratory side as well right now, because I mean that's how COVID came out.
Yeah.
People were on TV telling us how they're developing a vaccine. That's all marketing. Build anticipation. By the time COVID was out, everyone was rushing to do what? To buy it. So let's just head straight to the topic: emerging trends in healthcare marketing.
Piper, I would like to bring to you the understanding of openness of your mind in terms of what are the emerging trends. And like you said, it is everywhere. We are living with health marketing. So what is it? What are the emerging trends? I'll start with a few things that have come up really that I want to really maybe touch. One of them is for us, and especially talking about post-COVID, we need to realize what has changed in the minds or in the lifestyles of the people that we serve, that we market health to. COVID-19 came in with a lot of fear to people. It increased their consciousness about their health. So people are now aware that health is important to them.
Yes.
It has increased their consciousness in terms of searching for information. Many people were using Google to actually understand how can I treat COVID. Yeah? If you looked at the search engines, what is COVID was one of the high-ranking keywords being searched on the internet. It means really the population we are looking at is highly informed with a lot of information which partly is peer-reviewed and others is just probably misleading. But they're also cautious. So for the medical fraternity, the trend has changed. It is no longer the patient or the customer who is very green about their ailments. Someone will have backache and will Google, what is happening to my back? It is paining. By the time he comes to the hospital, he has all this kind of hazy knowledge around what could be the signs and symptoms. So the consciousness has increased as we have checked it, as people have evolved. But the other thing, post-COVID, people have tested how digital channels can be used to avail services. You know, people have seen how they were able to use, for example, Safe Border, Junior, to be able to deliver food to them. They are now looking and asking themselves, how can you deliver health to me? So convenience has come in, you know. So as a healthcare provider, in whatever layer you are, you need to understand that convenience is something that consumers are now actively asking for. They want the convenience of their service. But there has also been a very big ask for experience. You know, people now know things are possible.
Yeah.
People are no longer interested in coming to a hospital, queue for a whole line, for a whole day, just to see a medical officer, for example.
Mm.
You know, and that's where the aspect like telehealth or telemedicine has come in.
Yeah.
Because we understand that during COVID there was restrictions of movement. Yeah, our rich people, I'm avoiding the word politicians, our rich people who used to go abroad for health care now are looking for ways, how can I access the same health care from London, from UK, you know, in Uganda. So telemedicine has come in. And really that brings me to the aspect of what telemedicine is. You see, is accessing healthcare services using technology. So it could be the internet, it could be all these channels. And it is a big thing. If I'm talking about telehealth, I would go, you know, like for a whole day. But talk about telepathology. Telepathology is where, for example, a sample will be picked from a patient in a hospital in Uganda, and pictures of that slide are sent to a pathologist seated in the US or the UK and is able to give a diagnosis. That person has not seen the patient, but he was using the picture and the technology, and the diagnosis comes. So really convenience of services has really come up and it has grown telehealth. So I've seen most of the telehealth organizations grow in terms of revenues in COVID-19. You can talk about Rocket Health. In Nairobi, there's another one called Daktari. It also grew drastically high and did well. But you have also seen the big investors, big companies also starting to go health. Amazon has also gone health. They're saying we want to bring on Amazon Health because really they see a need.
They're definitely going to do it. Because the one thing I realized that Amazon did, when you're listing your products on Amazon, you have to give them an ingredients list of almost everything. So what they did, let's say for we used to shop, I normally shop for beauty products for people. So CeraVe, the Eucerin, all those SPF 30 creams. So what Amazon did, they made replications of these products. So for a CeraVe cream, there's an Amazon cream. For a Eucerin cream, there's a corresponding Amazon cream. Why? They already have all the ingredients in their exact percentage. So I can't wait for I honestly cannot wait for Amazon now.
Yeah, it is coming, and it is coming now. So, and I think this would be a call. You see, I think the myth that I want to break throughout this whole conversation is the fact that probably different industries do not think they need marketing. So gone are the days when you study medicine, for example, and set up a clinic in a village and then sit and relax and think that the patients will come. All the big hospitals in this country who have done incredible work in investing need marketers. And that's what we offered the Datamine, where we are giving people professional skills of how to market. So if you are a big hospital, you've done the investment, you need a marketer to sell the idea of patients coming there. Because it's the one who will know which channels do you need to go, how to improve the convenience. And even the doctors themselves need to understand some customer experience skills. If you're in government, this is the time to understand that that person that you are hiring should have some marketing skills. Send them to Datamine, let them have some marketing skills. Because you do not want to have a lot of vaccine expiring on the shelves. That's a waste to the government, So you need to really come and understand the professional skills of marketing at Datamine. If you are an NGO and you've gotten this nice money from the donor, that go and sell the idea of, for example, HIV self-testing, one of the projects I was working on before. You need marketing skills to be able to know that who are the people that will use this product and how do I communicate to them. You cannot come on radio when you know the young blood, the target market, are on Twitter, are on Instagram. What are you doing on radio? They don't listen to radio. So you need the skills. Even in the healthcare industry, you need the skills of marketing. And that's what we're talking about today.
Before you end that chapter, I even realized I should have asked you what are the emerging trends in healthcare when it comes to advocacy, when it comes to the government. But hold that thought. There are very many companies that have tried to push vasectomy in particular. So, pitch to them right now. If it were you and you're given that gig of, hey, we have this bunch of money, we're supposed to push vasectomy, and we're supposed to see vasectomy numbers go up, how would you do it?
I think as a marketer really is to understand that before you bring a product, you need to first understand the need. Because people connect with their problems. So for me, where I would start with is why am I bringing even vasectomy? Is it a problem? What is the problem? In Uganda, we have the problem of poverty. In Uganda, we have a problem of people not being able to educate their kids. When you have 100 kids or 5 kids, are you going to be willing to pay or even have the capacity to pay the school fees for them? So that's where you start. You have to connect with people at the things that they understand at an emotional level. As a health marketer, those organizations need health marketers, professionals, who will be able to understand the insights in the population and be able to bring services through solving problems of people. People will go for vasectomy when they know the benefit it brings on board. They're not going to bring it because, the donors have got the money. So you need professionals. So it's for you to understand. And there is a new phenomenon, again coming to you, a new phenomenon talking about trends in healthcare marketing, which is called the human-centered design, or what they call design thinking. Is where really where you involve the beneficiaries of a service in the structuring of strategy to sell it. So the thing will be, if we are selling vasectomy, to who? To the men. But do you know how the men want to utilize that service? What are the stigma attached around a man being called, useless in courts, that they already removed your thing? So the man wants you to speak to him in a language that will maintain his dignity,
Yes.
his ego. You need to communicate to that. So to change the idea, evolve them into structuring the strategies that work for them. And that's what we teach in marketing, and the Chartered Digital Marketing and Datamine.
All right. Well, you have me. If the dollars were mine, you'd be working by tomorrow. But all right. And insurance companies in Uganda have really tried to sell health insurance. Yeah, because the fact that we have listeners on right now, and by the way, guys, thank you so much for joining in. Say Mr. John. Mr. John is here looking, probably clapping his hands every time you say Datamine. But everyone, thank you so much for tuning in. The topic today is emerging trends in healthcare marketing. And for all our previous episodes, you can always find them on our YouTube channel. That's Marketing at Datamine. You'll find all of them. So back to the main point. We were talking about, yes, insurance companies and life insurance. How can insurance companies that are actually trying to sell health as a product tap into some of these emerging trends? Because when it comes to insurance, you can't do telemedicine. Yes, you can do customer insights. It's also an emerging trend. But what advice would you give to brands like those?
Okay, let me just unmute this. It's not unmuted. You can unmute it.
I have.
All right. So talking about the insurance. So one thing, I think something that I can tell to the insurance companies.
Wait, it's still muted.
Okay, am I muted? Can you hear me, guys? All right,
Yeah.
I'm right. One thing I can tell to the insurance companies really is, especially selling health insurance, is to tell them the cake is too big and you have not yet even consumed. There's still a lot for you to achieve, because when you think about health and financing in Uganda, around 40% of the health financing is done out of pocket from the people. People pay their money from pockets to access health services. It means the pain and the pinch of a person, the suffering of paying for health, is really in the people's minds everywhere you go.
Yeah.
The health insurance has lingered around the formal sector. Where someone is working for an organization and his company is probably paying the premium for him for health insurance. I think there's a lot that needs to be done in tapping into the informal sector, because that's where the people are suffering.
Yes.
Paying for health for themselves.
They can't afford it.
Yes. So think about products that can be, geared to the informal sector. People have their money, but they don't understand how you will pay the money and then you don't fall sick and then your money is gone. There's a lot of education that needs to be done.
Yeah.
People should really understand the benefit of it. And I don't think insurance companies have done enough noise about this.
They haven't. Because even in the formal sector, actually, like me, so many friends of mine have told me, hey, get some family, get life insurance. And I'm like, what? Why?
Yeah.
Yeah. So, yeah, you can go. You can just go.
So think about how you invest money, to pay for your car insurance, and the damage you have. Let me give you a small example. And this is really in pain in terms of how many Ugandans are going abroad to seek healthcare. I am talking about health insurance not only for the private sector but also for the public sector. We are in the East African community where Kenya, Tanzania, Rwanda has the national health insurance scheme. In Uganda, our national health insurance bill is still in preparation stage, preparation stage,
Yeah.
And in Rwanda, when a person gets sick, it's about taking their card and they get medication, quality of care, standard of care, and that pain is alleviated. When you pay upfront at the access of service, it is very painful, But when you know that you can pay bits and that money is put in a pool, so that your grandmother in the village who calls you every day that she wants Panadol, when they get sick, they go to the hospital without you knowing. without necessarily giving you a financial burden. That's why we need to go. We need to communicate this. So, and I think when we talk about telling people the benefits of health insurance, we need to move all around. We need to talk to the government, to the MPs who pass laws in this country, to talk to the local leaders who interact with people, to sell the idea of why health insurance is important. Because it is important. We need to sell it, and it is us to sell it. So the people who are on Twitter here, I can assure you, the people listening on Twitter are the allies of this world. Please, you can be the voice of changing the health of this country by communicating to all your colleagues that health insurance is not a burden, but it is an investment. It is an investment in improving the quality of life of Ugandans, us as a whole. If you want to improve your life expectancy, we need to go to health insurance. Why should you sell land because your wife is going to produce? Just swipe a card and you get medicine. Why should one rich guy go to US, to India, to change, to do organ transplant? When if we sponsor our health systems, we shall be able to have these services in Mulago. The technocrats are there. We just need to give them the resources to do it. So I think there's a big cake in insurance. We need more knowledge. People need to understand. And this is why I call the health economists. Yeah, people understand what is the benefit of improving people's health to the economy. Once we have a big population of young people who are healthy, they'll be more productive and our economy will work. We don't want people working in our oil industries very sick. So really, there is a big cake, and we need marketing skills. We need health economic skills to really push this agenda. So come to Datamine. We shall teach you the basics and the professional skills of how we can change. So the insurance companies that are listening, please send your people for professional marketing. You want to use people who know what they're doing, not people who are guessing, because human resource is one of the expensive things in terms of your organization expenditure.
All right, thank you.